Hi, I'm Dr. Katie Blevins. I'm here with Dr. Paul Quirk. We're here with the AWE 2026 series looking at all our different technologies. And Dr. Quirk's here to talk to us about CryoBalloon.
Hi, thank you. So we're here to talk about the C2 CryoBalloon. We use this balloon a lot for treatment of Barrett's. In particular, it's been studied for refractory Barrett's that may have recurred after RFA, but really it can be used to treat Barrett's right off the bat. And we can use it for some other indications like palliation of malignant strictures, also sometimes for what we call cryodilation, sort of freezing and then dilating more refractory benign strictures. The balloon comes in a few different shapes. This is their newest version. It's called the 180, so it's helpful for treating a bit of a longer segment of disease. Uses liquid nitrogen and freezes to negative 85 degrees Celsius, so the tissue reaches, I think, down to 40 degrees Celsius. It may go a little bit deeper than RFA, so you might get some better depth of treatment, but it's very, very safe, and one advantage is it's thought to be less likely to cause pain after the procedure than RFA. So why don't we hook it up here. The setup's very simple.
And it looks like you have a therapeutic scope. Is that to accommodate the device?
Yes, it does need a therapeutic channel. The gun screws in the nitrogen tank, and then we're good to go. And we can just position ourselves anywhere right along the treatment zone and inflate the balloon. And what I do is kind of pull the balloon back into the tip of the scope channel, and then our visibility is through the balloon. And the spray catheter is that black catheter going down the middle, and you'll see the liquid nitrogen spray coming out of there. So,
can you rotate the balloon?
Yeah. Oh, since you asked, I have a nice circumferential area, but so I could really start anywhere. But if we want to be a little bit more targeted, with my foot pedal, you'll see that catheter rotating. And then if I needed to, I can slide it up or down, or proximal or distal. So now I'll just start spraying. And it's going to work its way up. This is the 180, so what it does is it starts distal and it kind of automatically moves up the treatment zone. And it will shut off after 8 seconds or 10.
This is a 180, so we're actually ablating per millimeters per second.
Okay. So it just goes until it reaches the top, or the end of the catheter. For the more focal catheter, you can choose 8 or 10 second therapy. Mostly for Barrett's, I think 8 seconds is usually enough. And so,
How many times do you have to treat the tissue?
just once. You could do a second one if you really wanted to, but for most instances, once is enough. And then if I wanted to do the other 180, I can just repeat that process. Whoop, maybe overshot a little bit there. So the other advantage with this, as you can see, everything's done right through this balloon, so we don't need a tube in the stomach. You know, the liquid nitrogen is just spraying very locally. So it's not going down into the stomach where it can warm up and distend the stomach, so we do not need a decompression tube. So I'm completing another treatment, and I think that's it.